switch this All right, I think we have a lot of people joining now. Hello, everyone. Let me read everybody's name that I sent. Hi, Richard Dazzy. Richard, how are you doing? Trust you are doing great. Hello, Zachary, how are you doing? Richard, hi, our wife. Richard, do I know you? Do I know you from somewhere, please? I would like to know. So Stargate said hello. Lerato Malinga said hi. Hello, nice to meet you. Zachary, good evening. Nice to meet you again this evening. Good evening. I was unable to come live yesterday. Yeah, I was watching a movie. I was watching To Kill a Mocking. Yeah, I think that's the name of the movie. So I just finished it not quite long. So I was like, let me reason to say hi. So we have Eric Wekesa. Hello, Eric. How are you doing? Trust you are doing great. Yes, I could not make it yesterday because I was tired and I needed a break. So I had to use the opportunity to watch a movie yesterday. And I started the movie yesterday and I finished it today. Yeah, so that was what I was actually doing. That was why I didn't really pop in yesterday. So hope I'm forgiven. Sometimes we need a break. Anosienta. Hi ma. Hello Anosienta. How are you doing? Trust you're doing great. How are you all doing? It's nice having you all today. Popo from Italy. Popo, how are you doing? Popo, how are you doing? It's nice having you. Favorite said, hello ma, how are you doing? I'm fine. How are you doing, Favorite? Do you have any question for me today? Do you have any question for me today? Popo said, I'm doing good, thank you. What about you? I'm doing great. I'm here for you guys today. I'm here for everybody as usual today to take your questions. And if you're just joining this live, what you have to do is to double tap on the screen to like the video. And if this is the first time of coming across our YouTube channel, kindly click on the subscribe button. Yeah, thank you very much, Popo, for joining our live. On this channel, we talk about health in general. We talk about sexual and reproductive health. We talk about fertility. Those are the things we actually talk about on this channel. So if you have any question, feel free to drop in the comment section. And also, if you've not subscribed to our YouTube channel, can you click on the subscribe button and turn on that notification bell so you don't miss out when I drop a new video. We dropped a video yesterday on the causes of low testosterone. Yeah, we were able to simplify it as much as we can on the various causes of low testosterone. So I will advise everyone to actually watch the video on the causes of low testosterone. And if there are any questions in regards to that, kindly drop on the comment section. So Lorenzo Malinga said, oh yes, I would like to ask, feel free to ask, drop the questions in the comment section. Like I earlier said, I'm ready to take all your questions tonight. Popo said, are you from UK? No, I am from Nigeria, but I am currently residing in the United Kingdom. I'm from Nigeria, but I'm currently residing in the United Kingdom. So I am not from UK, but I reside there. So we have Costa Roseli said, hi, I'm from Sicily. Oh, I don't really know there. I've not been there. Trust you are doing great, Costa Roseli. How are you doing? It's nice having you all. We have Gina Kosua. Hi, hello Gina. How are you doing? Um, Popo said sure. All right. Um, Costa Roseli said hello Costa Roseli. Mrs. Vega, how are you doing? Trust you're doing great. It's nice having you on our live. Mrs. Vega, how are you doing? I'm doing great. It's nice having you on our live section today. I think my pencil just fell. I'll just move the chair back to grab it. Okay. This is what I used to calculate your cycle with my calendar here, so I have to grab it when it fell down. So we have a question from Stargirl. Stargirl said, "My period cycle is usually 24 days, but recently for 2 months cycle it reduced to 22 days. I've been doing exercise consistently for 30 minutes every day for 7 months now. Can exercise cause period? Yes." Exercise, too much exercise can actually delay your period. Some people it can make them come on time, some people it can make it come on time, some people it can delay it. So exercising, like, we are reduction in weight loss, drastic weight loss can cause delay in period or change in your cycle. Rapid weight gain can actually cause delay in your period and delay in your cycle. So for it to change to 24 days to 22 days, it could be as a result of your regular intense exercise that you have been embarking on. So it's not something to be concerned personally. So we have Popo, oh, okay, from Nigeria. So Miss Vega said, how are you doing? I'm doing great. It's nice having you here. Stargate said, can it cause periods to be shorter and come earlier? Yes, I think I've answered that question. Yes, Stargirl, it can actually cause periods to be it can cause periods to be shorter or to come earlier. Yes, it can. So you actually need to take note of that. Exercise can affect your cycle. Okay. So but if you notice that your menstrual cycle, the period, is less than 21 days, like you're having 20 days, 19 days, that's imbalance. That simply means you have to see the doctor in regards to that. So I don't know if that's clear, Star Girl. So we have Miss Vega. I'm good, thank you. Mrs. Vega said, good to hear that you are doing well. Thank you very much, Mrs. Vega. It's nice having you. Diamond weight loss. Do you ride a bike? No, I'm very lazy, so I don't ride a bike. But I'm teaching my daughter how to ride one. So Stargate said, how can I balance it out? One thing you should know is that too much exercise can actually affect your hormones. Even for the men, too much exercise can affect their testosterone level. For the women, too much exercise can affect your menstrual cycle. The best I can see you can do now is more or less like reduce. If you know you are doing intense exercise, if you can reduce it a bit, that might help. That might help a bit. But having a 22-day cycle, it's normal. It's okay. I don't know if, all right. So that's that game. Mrs. Vega said, you are from Nigeria. Yes, Miss Vega, I am from Nigeria. Yes, I'm from Nigeria. Diamond Whitler says, do you get the bus? Yes, I usually use the bus. Then my husband's drive most times. Most of the times, my husband drive, not husband, sorry. So Stargate said, thank you. Stargate, you're welcome. Thank you very much. I am glad I've been able to answer your question. If this is the first time of coming across our channel and you've not subscribed to our channel, kindly click on that subscribe button and turn on that notification bell so you don't miss out when we pop a new video. If you have any question, feel free to drop in the comment section. If you have questions in regards to calculating your cycle, feel free to drop in the comment section. So Mrs. Vega said, I am from Kenya, but married in USA. Is nice. That's good. That's good, Mrs. Vega. How is the USA now? What do you do? What do you do? Would you like to share? I think Mrs. Vega was in one of our live section and asked a question. I can't really remember, though I remember names, but I can't really remember the questions or what we're actually dealing with in regards to that. So that's okay. I'm having issues. Sorry, everyone. Just give me some time. Let me sort this out. Just want to sort this and take this off. So I think we have a question. Let me check. Okay, SK said water lubricant name. Tell me, when you say water lubricant name, what do you mean? Generally, water lubricant is advised, it is safe. That's all I can say in regards to that, except you have any specific question in regards to the use of water lubricant. So Sunday said, good evening, Ma. Sonny from Lagos, Nigeria. Thank you very much for Sonny for joining our live. I saw you in one of my live. So Lerato Malinga said, I always bleed after engaging in sexual activities. I consulted a family doctor. He said my cervix is swollen and he also prescribed medication, but still I bleed. Okay, you've consulted your family doctor in regards to that. Did he do some physical examination to, or did they carry out a test to actually show that your cervix is swollen? You get, and did you try to find out from the doctor why the cervix is swollen? All right. So I think you should find out from the doctor why the cervix is swollen, and also what medications are you on? So if you still bleed while you have sex, how, like, we're going to be analyzing the quantity. Like, is it a lot of bleeding during sex or just a little bit? Do you have pain with this bleeding or there is no pain at all? These are some things we need to take into consideration before giving like a general advice in regards to that. So you said your family doctor said your cervix is swollen and prescribed medication for you. So what I would advise you to do, you've taken the medications. If you finish the dose of your medications and it's not coming out well, you're not seeing results, it's still bleeding while you're having sex, I will advise you, if possible, stay away from sex during this period. Go back and see the doctor. Yeah, stay away from sex. Go back and see the doctor and let the doctor know that you are still passing through that same situations. If it's to do some physical examination and then tell you what next line of action you're to take. So we have Connor Webb. Connor Webb said Nige. Though I don't really know what Connor Webb is actually typing on the comment section, but if you have something very important to say, just feel free to type it. But I don't understand what Connor Webb is actually typing. So we have Lady White Melody, aka Omo Adeni Magbagbe. I don't know if I pronounced it very well. Lady White, good day. How are you doing? Trust you are actually doing great. I don't know what Connor Webb is typing, but I wish you all the best with your typing. So Mrs. Vega said, I did not ask a question. I came to thank you for the advice because I followed your advice and I'm pregnant. Okay, right. Okay, all right. Okay, there's no problem. Do you have any question? And how has the journey been so far? Like we said the other time, I told you congratulations and I'm super excited for you. If you have any questions, feel free to ask in the comment section and we will be ready and willing to take that question. So Sonny said, interesting question. Sunday, feel free to ask your questions in the comment section. Lady White said, I'm good, ma. Well done, ma. Thank you very much for that. If this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife, and on this channel we talk about health, we talk about sexual health, we talk about reproductive health, we talk about fertility on this channel. If you have any question, feel free to drop in the comment section. And also, if you have any questions, feel free to drop in the comment section. And if you are watching this video, just double tap on the screen and click on the like video. That's going to go a long way to help. He's saying a racist word. Seriously. Let's leave him here. When he's done, he's gonna leave. That's very bad for you to actually say that, if that's what he's saying, because I don't really understand what he's saying. I don't know what he meant by those things he's typing. But I think for someone to be doing things like that, personally, when you see people doing things like that, trying to do the racist stuff, I think those people are actually passing through a lot. They need help. They need support. they need emotional, physical, and mental support. So people you see doing things in regards to racism, they have a lot of trauma, they have a lot of things that's disturbing them, and they need all the support they can get. So I don't really know if that's what he is, the person typing all that is in terms of racist is passing through. But one thing I have to tell you is to stay strong and keep fighting. Stay strong. This racist stuff is not going to help. It's not going to take you anywhere. You have to try as much as possible to be a better version of yourself. Okay. I know you are passing through a lot. I know you are kind of probably having anxiety or depressed. Things like that happen. But if that's what you are passing through, I will actually advise you to see a psychotherapist or a psychologist or someone that can actually help you out, because instead of when you see yourself not utilizing your time properly, you start utilizing your time to type the racist stuff. It simply means something is wrong somewhere. It simply means that your productivity has actually reduced a bit. So I will advise, if you can see someone to get help, it's going to go a long way, seriously, to help you out. Yeah, I know it's not easy. I know I don't really know what you're passing through for you to be typing all that, but what I will advise you to do is to actually see a therapist. It's going to go a long way to help you, because having a racist mindset, it's kind of, I think it takes a lot. Like when your brain is supposed to be, when you're supposed to be thinking about something productive, but rather you are thinking about racist, like it takes a lot to do that. Your brain was supposed to be doing something and it's actually doing something else. So if possible, I would advise you to seek help and see how you can scale through. So that's my personal advice to anybody that's involved in things in regards to racism, because that's not nice. You're supposed to be productive. Um, Being racist is not really productive, as we all know. Like it's not productive. It's just trying to like bring people down. And sometimes things like that can be as a result of self-esteem that's been affected. Because if someone's self-esteem is affected, if someone's self-esteem is not like, if someone doesn't have a good self-esteem, racism might be the next option to help them boost their self-esteem, but that doesn't really help. So I will advise you seek help and also try as much as possible to boost your self-esteem without racism, without trying to bring others down, be it the color, the country or something. That's what I have to say, if that is what it is. Because somebody saying he's saying a racist word and I don't know the racist word, but if that's what he's trying to do, I will advise that particular person seek help. It's very important, and it's very urgent for you to seek help. I think for most trusts like the NHS, they provide useful help for those that are having issues with their they are having issues mentally. Like, I don't know how to put it, but seek help. That's what, in summary, that's what I have to say. Just seek help and get useful guidance in regards to what you're passing through, because I know you are passing through a lot to be doing that. You are actually passing through a lot. It's not easy. There are a lot of things going on in the country. There are a lot of things happening in the world today. People are depressed. People are anxious. People are passing through a lot, and they actually feel the best way to actually free themselves is to bring others down. You understand what I mean? So it doesn't work that way. Okay, you are not helping yourself. You're not helping your community, and you're not so helping your self-esteem. So that's my advice to you or anybody out there that is thinking about the racist stuff. I will advise you kind of channel your energy to something productive, channel your energy to something useful, channel your energy to something useful. You are going to see good results. Seriously, trust me, you're going to see great results. We can read a book, you can visit a library, you can do some charity work, you can do some voluntary work. It's going to go a long way to help you generally. So that's my take. That aside, if you have any question, feel free to drop in the comment section. I am willing and ready to take your questions. Okay. Do you have any questions? If you have any questions, feel free to drop in the comment section. I was actually watching a particular movie. I started the movie yesterday. It was a series, an episode movie. It's like To Kill a Monkey, To Kill a Monkey. So even a monkey can die shit like very easily. So I finished the episode today. Yeah, I actually finished it not quite long before coming live. Lady White, I didn't get your question, Lady White. Lady White, I didn't get your question. There's something about asking questions on YouTube. If it's against the policy, the questions are not going to the questions are not going to appear on my timeline. So what I would advise you, if there's a way you can modify the questions in such a way that it appears on my timeline, that's going to go a long way to help. So Stargate said, I have 2 more episodes to go. Yeah, I think yesterday I watched about 3 episodes. No, I think I watched 4 episodes yesterday. Then today I watched 3.5 episodes. Then today I finished the full episode. It's really an interesting movie. It's actually like showcased the challenges an average Nigerian face. Yeah, it actually tells us that a lot is going. There's a lot of analytics in that movie. There's a lot of emotions. There's a lot attached to that movies. So I will actually advise people to watch it. Yesterday I was supposed to come live. I was so stoked. I was so glued to the movie that I forgot to come live. So feel free to ask your questions on the comment section. Mrs. Vega, you retracted your question. Okay, when copulating, when having sex, what happened when the partner did not come? Are you talking about the woman or the man? Because it's not just the woman that come, it's not just the man. Sometimes the woman come, the man. So are you talking about the man or the woman, Lady White? When you talk about the partner did not come, are you talking about the man did not come or the woman did not come? So you have to be specific. The man did not come. See, there's something called is it retrograde ejaculation, in which the sperm, that's what was supposed to come out, through the penis, but is going into the bladder. I think it's retrograde ejaculation, they call that. It's going into the bladder in such a way the man feels that, okay, I've come, but nothing is coming out. So if something like that is happening, I will advise for him to see the doctor. You get, if something like that is happening, if he's not the one withholding it. Some men have the capacity to hold themselves to not come in, and that makes them last longer because they are holding it. They want to last longer. They want to like carry on with some they want to last longer, so they tend to hold the sperm. So if he's not the one holding it, and you notice that whenever you are having sex regularly and still he is not coming, I think the first thing you have to do is to have a conversation with him. If you are free with this person, like, is your partner, so I think you should have a conversation with him, like ask him, like, are you the one holding it? It's as simple, but you know your partner better. You know the best way to actually bring topics like that to his table. You understand? So have a conversation with him that I've noticed this is happening, especially if you are trying to conceive, which I don't know. You let him know that I've noticed this is happening. It's happening regularly, and I don't know why it is happening. Are you the one doing it intentionally, or there's something wrong? Like I earlier said, there's something called retrograde ejaculation, in which the sperm doesn't come out, it goes into the bladder instead of it to come out because something is wrong up there. So you have to have a conversation with your partner. If he is also disturbed by that fact, that's to show that he's not the one like holding it, it's not his fault, then he has to see the doctor in regards to that. Sometimes we tend not to see the doctors for this minute thing, and over time when we want to conceive, this becomes an issue, this becomes a major issue. So that is why I generally advise, when you notice something deviation from normal, it's very important for you to talk about it and also see the doctor. Edbe, now why you said, good evening, Osmary. Good evening. How are you doing? Trust you are doing great. Oluwa Bumi Dada Sunday. Can you see my question, ma? Yes, I can. No, sorry. No, I did not see your questions. Your questions are not applying. They are not appearing on my timeline. Like I earlier said that if you drop your questions and I can't say it, it's possible there are some things you've written that is against YouTube policy. So the question is not going to pop up. The questions are not going to pop up. So somebody's asking, Ebube said, Ma, is it possible not to see your period for 1 month and the other month it is flowing continuously? And when you want to urinate, it is painful and one funny smell. Okay, when you say it is flowing continuously, does it mean it has flowed past 7 days? It's more than 7 days you've seen that period. So I would like to know now where you're Edube. Does it mean that you said you didn't see it for 1 month? And a month that you saw it is flowing continuously. Doesn't mean it has not stopped, it's still flowing, or it flows for more than 7 days. I would like to know in the comment section. Edube, I would like to know in the comment section, please. So you have to see the doctor. It's not normal. So if it's like that, you have to see the doctor, please. You have to see the doctor. You have to see the doctor as soon as possible, because and now you're saying that when you want to urinate, it is painful and one funny smell. That painful urination and the funny smell can be a sign of infection. All right. But that period flowing for a long period of time after 7 days, that's something different entirely. So what I would advise you to do is to book an appointment to your doctor, get seen by the doctor. Almost 17, go and see the doctor as soon as possible, please. Go and see the doctor as soon as possible, please. All right, 17 days is a lot to bleed. So it's something that needs to be sorted out. So please and please, Edube, go and see the doctor. Go and see the doctor. That's my advice. So Zumani said, good evening, nurse. Thanks for all your beautiful lectures. You're welcome, Zamani Esther. Trust you are doing great. It's nice having you here. If you have any questions, feel free to drop in the comment section. He said, but when he tries using his hand, he comes. That's strange. In regards to this, what should I say now? When he tries, you said he doesn't come inside, but when he tries using his hand, he comes. What is coming to my mind, I might not be right, is could he be used to, I don't want to judge, like I'm just assuming, don't take it personal. I just feel, could he be used to masturbation? Because I just feel if someone is mentally used to masturbation, and this person usually comes with his hand on a norm, so that might affect his sexual life with his partner. You get, because normally he was supposed to come inside, but now he doesn't come inside. He doesn't feel like he can come inside. He's coming outside with his hand. That is probably, maybe he has had a past experience, or maybe he is used to masturbation or something. Why don't you have a conversation with him? Have a conversation with him and see how you can try to help him. I think you should have a conversation with him. Yeah. Is he like in, I'm not saying he is, but most times people that masturbate, they come with using their hand. So in such a situation, you just have to ask him if he is masturbating, and also have a conversation with him. If there's something very serious, then you, okay. Oh, he's used to masturbation even before he started having sex with you. Just let me know in the comment section, because that can actually result with this whole thing. If he was masturbating frequently, that can affect his sexual life with you, which is going to take time. That's why I am saying that communication is very, very paramount. So that could be the reason. Lady White, that could be the reason. Like you said, he's masturbating. So it's possible his mind is programmed, or he's already programmed his mind to like, the only way I can come is through masturbation. Like generally, men, when having sex, there are some particular position that kind of make them come. There's a particular position when having sex with their partner can make them come. So if a man has already programmed his mind that this position makes me come, probably he has programmed his mind that the only way he can come is with his hands. So that is why most times he end up taking it out and using his hands. So I don't know if I'm making sense to you. I think the best thing you can do is to have a conversation with your husband or your partner and see if there's any way both of you can work together. If there's any particular position he feels can make him come, if there's any particular position he feels that makes him stay harder and make it come inside of you rather than outside. I think that is why the conversation with your partner is very important. It is very, very important. Is that clear, Lady White? Okay, he said yes. You are right, ma. You can say okay. I was thinking, at least I'm right because from when you dropped the question saying that the only way he comes was when he used his hand, I knew that might be related to masturbation because that's one of the dangers of masturbation, the effects of being addicted to masturbation that is not fully talked about. So that was why I made a particular video about masturbation. I've made several videos on masturbation. So because sometimes we feel okay, masturbation is therapeutic, masturbation has some benefits, but there are some negative aspect of masturbation which is affecting a man's sexual life with his partner. So that's something you should actually take note of. So let's go back to the next question. Okay, Sunday said, what essential knowledge or skills should I acquire regarding the mental and psychological aspect of a virgin female individual? In terms of, okay, if you want to have, are you talking about having sex with a virgin? Is that what you are trying to talk, Sunday? Is that like, you said, what essential knowledge or skills should I acquire required to mental and psychological aspect of a virgin female individual? Are you talking about like you just got married, having sex with a virgin? Like, is that what you're trying to talk about? Is that what you want me to talk about? So I would like to know in the comment section, Sunday. So Andrew Grace, hello, how are you doing? Trust you are doing great. So okay, and he said yes. So when it comes to having sex with a virgin, I think the first thing is the mindset. Okay, the first thing is the mindset. um First of all, I think women are moved by emotions, women are moved by what you do, so you have to be extremely romantic. So you don't just say, oh, you want to just go inside, you just want to have sex. The first night is going, like the first time you're going to be having sex with a virgin, make that full day very interesting for her, make her very comfortable, like make her be the priority, make her feel very extremely special because she's already special to you. Make her feel extremely special, get her gifts, watch movies together instead of her to do the house chores, try to do it yourself. Like just make her feel, elevate her mood. So when you elevate a lady's mood, that's a one step to making things easy, to making like everywhere very soft. You understand what I mean? So after you finish making that day very interesting and very exciting, and the next thing is to get, what I advise is to actually get a lubricant in handy, get a lubricant close by, because sometimes having sex with a virgin, penetration might be difficult. And while you are doing that, it is very important for you to have a conversation with this virgin. It's very important for you to talk to her. All right? Talk to her. Like the first step, like I said, sweet, prepare everything during the day, make her feel special, like love, like just shower her a lot of flowers, a lot of blessings, make her feel extremely special because that's going to make the night very good. The next thing, have a conversation with her, like if she really wants it, because you don't want to impose it on her. Because once you impose it on her, she might not like it. Once you try to force yourself into her, she might not like it. She might all of a sudden develop hatred for sex. So the first thing is to, like, after doing that, you have to like have a conversation with her. Is it something she's ready for? Hopefully, I know you want her to be ready, but ask her, is she something she's ready for? What does she likes you to do? Let her know that you're getting a lubricant to make things easy. And also during the first night, go slowly, like take it one step at a time. She might actually bleed. Because one thing you should know is that not all virgins are going to bleed on the first day of their first sex. Not all virgins are going to bleed on the first day. We are made to believe that when you have sex on the first day, you're going to bleed. Not all virgins are going to bleed. Just put that at the back of your mind. Get lubricants as a standby. Be very romantic. It's going to take time exploring her, like, how will I put it now? What they call it now? Her G spot. It's going to take time for you to understand her G spot. It's going to take time for you to understand things that make her calm. It's going to take time for you to understand things that make her want to be in the mood. So you're going to be exploring her body, like gradually, one step at a time. The first night might not be the best night. The second night might not be the best night. But as time goes on, you tend to understand her body better. As time goes on, you tend to know, okay, whenever I touch her, this part of her body, she feels more excited. Whenever I touch this, she's lost. Like, just look for, as time goes on, you start exploring her body and knows what actually turns her on. You start understanding her better because this is your partner that you are building life together. So that's one thing you should take note of, like exploring. So that first night, try ask her because you're seeking permission from her. Like I said, don't force it on her. Don't make that first night like tragedy for her. So you have to make it like more romantic if possible, lighten the like just make the room special. Just do anything special that you can do depending on your financial capacity. Do anything special you can do for that lady depending on your financial capacity, not just finance, your words, what you say. Words go a long way to affect ladies. All these things are going to go a long way to soften her vagina in preparation for your penetration. So that's I think that's my advice I will actually give you when it comes to having sex with your partner. That's having sex with your partner that is a virgin. So yeah, that's it. You see, okay, Sunday said she does tell me that I'm not romantic. You can say, so you have to be more romantic. You have to do things more romantically. You get, take note of what she's saying. Take note of what she's saying. Things that she says she needs. Just get it out of the blues. If she just whispers something, oh, I would have loved to get this pencil. She just whisper it. Like take note of those things that are important to her while she's talking. But she's not directly telling you to get it. Keep it. When you want to buy gift, those are the things you will buy. It simply shows that you care about her. You are listening to her concerns. You get, when she's in the kitchen, just, oh, let me assist. I know you are stressed out. Take over. Like, God, just assist in a little way as you can. Like, oh, you're just sitting down. Let's go out. Let me get you some. Just when you are far away, you are at work, and this person is at home, send a message. Do you know I'm missing you? Do you know I love you? I can't get my head off you. Last night was wonderful. I just want, even if you've not had sex, like last night with you, like I just want to spend the rest of my life with you. I like, just send something romantic. Just send something romantic while at work. All these things have a lot of work it's going to play in your lady's life, and also it's going to make sex more easy for you. All right, you have to be extremely romantic to actually get a lady. That is why it is very easy for men that are romantic to get a lady than men that are not romantic, because ladies are generally moved by what they hear and what they see. Like, I think what they hear more, what they hear, what you have to say about them. So you have to work on that and be more romantic, Sunday. You get, it's very important for your relationship. It's very important for your marriage. You have to work on that. Ladies are unique. So to get them, you have to be very romantic, because with that, I think penetrations are going to be much easier. Penetrations are much easier when you're romantic. So that's that. Um, so we have a question from Frank Dominic. Oh, I think Frank Dominic sent a question. I have a question regarding osteomy care in the nursing field. What is the recommended frequency for changing an osteomy bag, daily or when it is full? First of all, when the osteomy bag is filled up, you have to change it. When it's filled up, even if it's not up to 24 hours, definitely you have to change it. Okay, you have to take note of it. You have to be like, you have to observe it, because if it is full and you don't change it, it's going to be pulling. It's going to be like, it's going to smell, and it's going to be pulling, like it's going to be causing more pain to the osteomy site. So when it is full, it is very important for you to change the osteomy bag. I don't know if Frank Dominic is, I don't know if Frank Dominic actually gets the I don't know if Frank Dominic gets the answer to his question. I just saw the question and I've answered it. I hope you're still online to listen to the answer to your question. So Lady White said, yes, ma, thanks a bunch, ma. You're welcome. Wise Madine, how are you doing from Malawi? Wise Madine is always joining our live. It's a pleasure having you, Wise Madine, on our live section today. Sunday said yes. Okay. Frank Dominic, great job. Thank you very much. You're welcome. So Edube, where I said, please, ma, I wish to ask if family planning can be the cause of what I'm facing, because I'm on family planning for 3 months. What exactly did you say you're facing again? Sorry. Edube, what did Edube tell us today? Yeah, it is possible. Yeah, if you just started the family planning method, it is possible. It's very, very much possible for the family planning to be the cause. So what I would advise you to do, Edube, is also tell the doctors that you're on this family planning, because people react to family planning differently. You get, it might be as a result of the family planning you just started. So speak to the doctor about the family planning. If it is the family planning, the doctors might remove it and provide you with different family planning options. They might remove it and provide you with different family planning options. So family planning can go a long way to alter your cycles. They can go a long way to make you bleed. Some people bleed, and after some time it goes back to normal. So it's better for you to speak with the doctor in regards to the family planning and get things sorted out, because bleeding for 17 days is actually a lot. It's too much. Personally, I would say it's too much. But see the doctor and confirm, especially when you said you just started the family planning method. So that's what I have to say. So Sunday said, wow, thank you so much. You are welcome. You are welcome. So Ebube Wanya said, all right, ma, thanks, ma. You're welcome. Frank Dominic said, great job. You're welcome, Frank. So if you have any question, feel free to drop in the comment section. Women are moved by what you do and also what they hear. I'm a woman, so I'm moved by what you say and what I hear, what you do. So I believe that's going to help you Sunday. Do we have any questions again? So I'm supposed to stay in this life for 1 hour. Life is to last for 1 hour. She's a various woman. Oh my God. Yeah, you have to try your best, okay? You have to try your best. When you're at work, you don't wait for, say, I would always say, as a man that wants to have sex at night, it doesn't start at that particular night if you really want both parties to be involved. It actually starts in the morning. Yeah, your actions in the morning are going to put her in the mood or take her away from the mood. Even if she's making you angry that period, don't try not to make her angry. Okay? Try not to make her angry that period. Try to be on her good book throughout. Try to be on her good book throughout. Try to be on her good book throughout. Try to make her happy. Always send lovely messages. You don't have to be at home before you start the conversation for what you want to do at night. You have to start in the morning. Start preparing the foundation in the morning for what you want to do at night or what you want to do in the afternoon. So you have to start preparing the foundation at the very in the morning, sending your messages at work. It doesn't have to be like this. I believe your partner, you both parties, they know their financial capacity. You know what you can afford. Your partner know what you can afford and know what you are capable of doing. So if you want to have sex in the evening, start the preparation in the morning, sending messages, helping out in little things, just prioritizing her, giving her a break, getting her as little as chocolate. It's not every woman that likes chocolate. I mean, I don't like chocolate. So getting her little things as chocolate, getting her little gifts, just something that she wants. Trust me, it's gonna go a long way. It's gonna go a long way. And I will always say that the outcome of a sex, it's actually it's very great when both parties are involved, not just the man trying to come. When both parties are involved, both parties tend to like have a conversation after sex, sort issues out after sex. Like that's why they say when couples are quarreling, you don't intrude because they are going to settle it in bed and put you at the middle. All right. So it's not just in bed after a worst or a painful sex for the woman, in bed after a wonderful sex with both parties. So that's that. If you have any question, feel free to drop in the comment section. And if this is the first time of coming across this channel, my name is Mercy Mary. I'm a registered nurse midwife. Currently practicing as a registered adult nurse in the UK. Feel free to click on the subscribe button, turn on that notification bell so you don't miss out whenever we drop a new video. And also feel free to double tap the screen and like the video. Double tap the screen and it automatically likes the video. So Sunday said chocolate. Yeah, not all women like chocolate actually. Personally, I don't like chocolate, be it dark chocolate or white chocolate. I am not a chocolate fan. So you can actually buy me a box of chocolates now. I believe you as a man, you should understand your partner properly and you should understand your spouse better. So that's going to go a long way to know what she wants and what she doesn't like, what she wants, what she doesn't want, what she likes and what she doesn't like. Do we have any question? She's a very idiot woman. Okay, someone is asking a question. Hi, is it possible for someone to be pregnant while seeing? I think I know what you want to say. Is it possible for okay while menstruating? Yeah. Is it possible for someone to be seeing to be pregnant while seeing menstruating? No, it's very rare. It's very like it's not possible, but nothing is impossible. But it should be very very real, but it's not possible generally. So when you are pregnant, you are no longer ovulating, so there's no menses. So anything you are seeing in form of a blood when you are pregnant is not menses, maybe something else. So when you are pregnant, if you are seeing menses, if you are bleeding, I advise you see the doctor. I have a very bad habit, so I'm trying to stop it. I'm always picking. I try not to get pimples on my face because I'm always picking on them. You can see I'm already doing it on the camera, which is a very bad habit. I'm trying to stop it. So that's my very, very bad habit. I just try to pick my face, but it's not a good thing. So I am waiting for your questions. If you are watching this live, double tap the screen, just double tap the screen and it automatically likes the video. Double tap the screen, it automatically likes the video. My hand is going again to this place. My hand is going again. You can see. Remove your hand, Mercy Mary. I try as much as possible to avoid any pimple on my face because I have a bad habit with it. I'm just subconsciously doing it, which is not really nice. So I'm waiting for your questions. If you have any question, I have like 10 minutes to go on the live section. If you have any question, feel free to drop on the comment section. I have 10 minutes more to go. Is it up to 10 minutes? I think 11 minutes. Let's just say 11 minutes more to go on this live section. Then the live will be ending. 10 more minutes to go, then we will end the live. If you have any question, drop on the comment section. But if no question, we'll be going offline in the next 10 minutes. I have my calendar here in case there's anyone that wants to know their cycle. So I can use this to help. If you want to know your cycle, I can use this to help you out. All you just need to do is to drop the start date of your menses. Drop the start date of your menses, and with that, I am able to calculate your cycle. Do we have any question for Messi Mary? Do we have any question for us tonight? The life is almost coming to an end. It's coming to an end in 9 minutes time. 9 minutes time. If you have any question, feel free to drop on the comment section. So we don't have any questions. Andrew Grace, did you get answer to your question? Andrew Grace, I've answered that question. You said if it's possible to be pregnant and still see your period. And I said no, it's not possible to be pregnant and see your period. And if you notice any bleeding or any measles or something like that while you are pregnant, it is very paramount. It's very important for you to see your doctor, because it is not normal for you to be pregnant and still be bleeding, because that might signify something else. Because for menses to take place, you have to ovulate. But once you get pregnant, your body can no longer ovulate again. So the menses is not going to pop up. So it is not possible. But if that happens, see the doctor. So Andrew Grace, did you get the answer to the question? Andrew Grace, did you get the answer to your question now? Andrew Grace, did you get the answer to your question? It's like you drop the questions and go back, then later you come again. I've answered the question now, and I believe you've got an answer to the question. It is not possible. It is not possible for you to have your menstrual period while pregnant. If you see something that looks like your period while you are pregnant, then it's something for you to go and see the doctor about. If you're watching this live and you've not liked the video, all you have to do is to double tap the screen and it automatically likes the video. And if you've not subscribed to our YouTube channel, please click on that subscribe button, turn on the notification bell so you don't miss out when we drop a video. Tomorrow, we might be dropping a video tomorrow. I don't know if I'll be coming live tomorrow, but we might be dropping a video tomorrow. Tomorrow, we're going to be dropping a particular video tomorrow. All right. Okay, Andrew Grace. All right. You're welcome. You are welcome. You are very much welcome. You are very much welcome. Coded Complex, how are you doing? Trust you're doing great. It's nice having you on our live. Do you have any question for us before we go? Coded Complex, do you have any question for us before we leave the live section? Oh, that's good to know. It's good to know you're great. Do you have any questions for us? Okay, feel free to ask a question. We have 5 minutes to go. Feel free to type your questions now before we go because the live was supposed to last for 1 hour. You're welcome, Grace. So coded. So Juliana, we have Juliana Fabian W. Simbo said, how do you go about to conceive twins? How do you go about to conceive twins? Personally, I will advise if you want to conceive twins, the best thing to do is to see the doctor. Probably the doctors are going to give you some medications that will stimulate your ovaries to release eggs because most times your body release one egg every month. So if the doctor gives you this medication such as clomid, it's going to stimulate your ovaries to release more eggs in such a way that when you have sex, two eggs will be available to be fertilized. So that's one of the ways your doctors are going to guide you through. But before you take clomid, before you take any of these things, it's very important for you to speak with your doctor in regards to that, so you don't end up doing yourself more harm than good. In some countries, they allow you to conceive twins with these medications, but in some countries, it is prohibited. It is not allowed. So that's something you should take note of. In some countries, it is allowed. You can take medications, you can get twins, you can stimulate your ovaries, you can get twins. But in some countries, it is not allowed in some countries. So you have to look at your country's policy and see if it is allowed. Consult your doctors and let them help you through. They give you medications to help stimulate your ovaries and your ovaries produce eggs. So Coded Complex said, I am 10 months gone, but I'm confused about so many things. Can you please let me know what you are confused about? Okay, 10 weeks. Okay. I thought you said 10 months because 10 months is like you're already close to delivery. 10 weeks gone. Yeah. I was seeing discharge early today. What kind of discharge? Is there blood in it? It's just like is it your normal vaginal discharge, or there is blood in it, or it's just heavy? Do you have a way best you can describe how the discharge is? You can describe it in the comment section. Discharges are normal from the vagina. As a lady, it's normal for you to have discharges. All right. So Sunday said, please mark if you stop it from coming from your nose and it is dirty and you're not taking medication, what will happen to those deaths you stop? Sunday, your questions is not clear. Your question is not clear, Sunday. So yellow in color. Generally, coded complex, it is normal. It is normal to have that yellowish discharge in pregnancy, especially if it is thin, it is whitish. And if it doesn't cause any itching, you are not having itching, it is odorless, it is not smelling, it's not causing you any discomfort, and it is thin, then it is normal. But sometimes those yellowish discharge might signify infection yet that needs to be treated. So what I would advise you to do, if it is yellow, it is very colorful, you're having itching alongside with it, and you're getting discomfort from this discharge, then you need to see the doctor if it's an infection to get it treated out. But generally, yellowish discharges that are thin, that are colorless, that are whitish, it's not something to be worried about. Sunday said, if you stop catarrh from coming out and it was dirty, it's not dangerous to your health. I still don't get Sunday's question. Sorry. Zamani said, please, what could be the cause of pain during your period around your stomach and how can you reduce the pain? So, pain during your period are usually related to things that are taking your endometrium shedding. That's your womb, the inside of your womb. The inner part is pulling out, is coming out. Eh? So, there's a release of a hormone known as prostaglandins. So, those prostaglandins are usually what is perceived to be the cause of those pain. So what is advised for you to do, what is advisable for you to do is that you can take some over-counters painkillers. You can take some over-counters painkiller. Just you can use like there's what we call this period pack. They contains things that you can use during your period. You can use a cold compress or around that area to help reduce the pain. Try as much as possible to get rest, and you can use some diversion therapies. Get busy with something that you like, depending on your energy and strength at that particular moment. And if the pain is severe and it's stopping you from carrying out your activities of daily living, then I would advise you to see the doctor. So Coded Complex said, when am I supposed to start antenatal? Personally, I advise antenatal as from 8 weeks. So since you are 10 weeks gone, I will advise you to see the midwife and start your antenatal because there are some supplements that can be given, such as your folic acid, that are very important at the early stages of pregnancy. So your midwife, they are able to, like, depending on the country you are, in some country, the health centers, the midwives are the one that do these. They give you the supplement. While in some countries, the doctors and the GPs are the one that start like give you advice in regards to supplements to take or something like that. So what I would advise you to do from 8 weeks, it is very important for you to at least register with your midwife. So you're in Nigeria. I think the policy is quite different in Nigeria. You can get your, at this particular stage of your pregnancy, which is 10 weeks, I will advise you to start taking your folic acid. Start taking your folic acid. Immediately, any pregnant woman notices that they are pregnant, the first thing that should come in the radar is folic acid. You buy your folic acid and start taking it. Yes, because it is very, very important for the brain and the spinal cord formation for babies. It is very important for you to take your folic acid in regards to your brain and your spinal cord. Then if you are not having any discomfort, as soon as you can register with you can register for antenatal care. Generally, I advise registering for antenatal close to your house in case there is any emergency or things like that. At least you know that the people that have your records, your antenatal records, are close by. So I usually advise, if you have a very good hospital that is trusted and confirmed, you should do the antenatal registration close to your house to make things easy and also mobility very easy for you. So that's my personal advice for Coded Complex. Congratulations, and I wish you the very best. Is folic acid only for, no, when you are pregnant, you can take it. Like especially the first 3 months of pregnancy, it's important for you to take it, especially in the first 3 months of pregnancy. Sunday said to use a drug to save that death from coming out instead. I have no idea in regards to how I have no idea on the best advice to give you in regards to using, like in regards to using drugs to save death from coming out from your nose. I have no idea in regards to that. Okay, Jelena said, what is the actual purpose of folic acid? I think I've explained it. I said folic acid, it's very important when it comes to the formation of the baby's brain and also the spinal cord. Okay, it's very important when it comes to the formation of the baby's brain and the spinal cord in pregnancy. So I don't know if Juliana, you've gotten that now. Let me know if you've gotten it in the comment section, Juliana. Okay, Coded Complex, ask your questions. I will try as much as possible to answer the few I can. But if not, tomorrow, just come live by 9:10. I should be live. All right. So, Juliana, did you get the answer to your question? Juliana? Oh, so you need it, yeah. Since you were advised by the doctor to be taking folic acid on a daily basis, that is, you really need the folic acid. In such a situation, what I also advise you to do, Juliana, is to actually work on your diet. Try and eat more of green leafy vegetables alongside, especially now that you're pregnant. Eat a lot of leafy green vegetables because they are actually very rich in folic acid. It's going to go a long way to help you in the early stage of pregnancy because you are anemic. Definitely, the folic acid is what is helping out, and you have been taking it daily. So continue taking it on a daily basis and modify your diet. Eat a lot of green leafy vegetable. Someone told me folic acid fertilizes womb. I don't really. Folic acid is majorly. It doesn't fertilizes womb. Folic acid is not a fertility drugs. I think people should take that. Folic acid is not a fertility drugs. It doesn't fertilize the womb. What it is helping is that it's helping your body. It's helping like build your folates. It's helping to build the folate in your body, which is responsible for your red blood cells and everything. So if you don't have enough of that folic acid in your body, if you don't take enough, your body doesn't produce enough of it, it can affect your baby's brain and spinal cord. That is why they advise pregnant women to start taking it, especially when you are trying to conceive, to make sure that at least your folic acid is on a normal level. So when the baby comes, the brain and the spinal cord are formed properly. So not that folic acid is not a fertility drugs. It is taken because of the baby that you are going to form, that's already formed. Folic acid is not a sperm that fertilizes the egg. So that's something you should take note of. Folic acid is responsible for red blood cells production. So that's why they tell you to take folic acid. So folic acid is not like a fertility drugs. It's for red blood cells production. And when your red blood cells production is very low, it's not enough, it can affect your baby's formation of the brain and spinal cord. So that is why they usually advise those that are trying to conceive to take folic acid. In case the baby is formed, you have a baby growing in your womb, that is going to help with the brain and spinal cord formation. So coded complex, I have been waiting for you. Like I said, the live was supposed to end, but since you said you have a lot of questions, we might talk about it tomorrow. I'll just stay 3 minutes more, then we'll go. We might talk about your questions tomorrow since it's a lot and we've not even gotten one yet. We might talk about your questions tomorrow, preferably. Just try and subscribe to the channel, then turn on that notification bell. When you turn on the notification bell, you will get notified when I come live. So when you turn on that notification bell, it will tell you automatically that nurse's lecture room is live. Then you join and you'll be the first to ask all your questions. Then we'll answer all your questions as soon as possible because you said you have a lot of questions, which is, when you say a lot, it might take a lot. It might take a lot of time to actually sort them out. But when you are here tomorrow, it's going to make things much easier for everybody. Okay, coded complex said I joined with my husband's phone. Okay, so are you gonna join us with your phone tomorrow? Let me know before I end the live so we can just talk more. We can talk better tomorrow on tomorrow's live section. Okay, that was good. So we're gonna see you on tomorrow's live. So if you are joining this section and you've not double tapped to like the video, what are you waiting for? Before we go, just double tap and it automatically likes the video. Thank you everybody that have stayed. This is a clap for you. Thank you for staying on our channel. Thank you for dropping your questions. Your questions have made the live sections more interactive. We hope to see you all tomorrow. Fingers crossed. Yeah, we'll see you tomorrow between 9 to 10 p.m. Probably 10 p.m. to 11 p.m. We will be live and we will be ready to take your phone. So what I would advise you coded complex is that take your phone, subscribe to Nurses Lecture Room YouTube channel, turn on the notification bell, because if you don't turn on the notification bell, you will not get notified when I go live. Okay, you will not get notified when I go live. So coming tomorrow. For all those that I'm not going to answer their questions, if you notice, I'm a bit exhausted. So I've spent 1 hour already. So tomorrow we are going to be live from 10 p.m. to 11 p.m. From 10 p.m. to 11 p.m. And I'm going to take all your questions tomorrow. So Skydy, see you tomorrow, please. I'm sorry I'm unable to take your questions now. The live has ended and I need to get a bit of rest. So thank you everyone for joining. Skydy, see you tomorrow with your questions. Sorry I'm unable to answer any question now. Thank you very much.